So before any practitioner or researcher can recommend an intervention, it's important to look at the balance, benefits, and risks. So I've talked about the benefits. The benefits are modest, perhaps a 15 to 30% improvement in some symptoms, and certainly not proven in all studies. Luckily, the risks are very low. So every single study that I've read that has been published said the risks were infrequent and tolerable. So very few people pulled out of the studies due to side effects. But I have to mention that in one study, there was a huge rate of people pulling out of the study, not due to side effects, but because they didn't feel the drug was working. So the side effects of LDN are generally well tolerated, even by people who are moderately to severely ill. This is incredibly important in our community where so many people are sensitive to everything. The top 3 side effects reported are vivid dreams, diarrhea, and headache. And at the risk of sounding like a medication TV commercial, less commonly, people experience insomnia, nausea, dry mouth, shortness of breath, anxiety, agitation, increased hair growth. Don't get that one. Increased sweating and dizziness. So my conclusions are that although the signal of benefit is modest, the risk of harm is even lower, and therefore I think it is worth a try, both from the perspective of side effects and financial cost. It's accessible to many. If you discuss LDN with your prescriber, make sure you're able to adjust the dose to what you tolerate and need. This is super important because there's a very wide range of effective dose. There's no single dose that works in most people. Now, the typical way to start LDN is to begin at 1.5 milligrams a day, taken in the hour before bed, except if it causes insomnia, in which case it would be taken in the morning, and then increase by 1.5 milligram increments, typically to a dose of 4.5, but sometimes higher to 6 or even 9 milligrams. Now, how a trial works in an individual is you keep increasing the dose slowly over a period of weeks to months until you notice either a benefit, in which case you celebrate and you make a decision to stay on the drug or the intervention longer because you're liking what it's doing, or you don't notice very many benefits and you start having side effects, in which case you would usually pull back a little bit on the dose and wait and see if a signal of benefit occurs. Now, adjusting the dose is pretty easy because LDN is compounded. So a compounding pharmacy can make any dose that you and your doctor request. And if you are severely ill or you have something like MCAS, you want to be really sure that you have as few non-medicinal ingredients in that capsule as possible. And you may even want to start at a very, very tiny dose like 0.1 milligrams and slowly build up. If you start, in your mind, commit to a 3 to 6 month trial, because although you may see positive effects sooner, for many people, it takes the full 3 to 6 months to get the full impression of how beneficial it will be for you. And because it's very hard to keep all of this in your head for 3 to 6 months, I strongly recommend that you keep track of what's going on so that you use a symptom tracking app and maybe a wearable wearable tracker so that you can feel confident about your perception of whether it's benefiting you or not. The reason this is so important is because a couple years down the line, someone else may recommend this medication to you, and if you can't remember that it really didn't work or it even made you feel worse, you might go through that whole process again. To read more about LDN, and if you want to see the references upon which I based this video tip, you can go to my free blog page www.eleanorsteinmd.ca/blog. And if you can't remember that or it's too hard, just go to my homepage. At the top, there's a drop-down menu called Free Resources and Helpful Blogs. I believe it's the second one down. Also in that drop-down menu, there's a ton of free resources, including videos, audios, publications, and other really useful websites. So good luck with your decision about LDN. I hope this was helpful.